today I understand you want to do all 3 areas.
Let's do it.
Because you loved it so much the first time, right? Everybody does. All right, well, let me take a quick look at your muscles here and see exactly how many units I think you're going to need.
Okay.
I know with your crow's feet before, we used a pretty standard dose of the equivalent of 10 units of Botox on either side.
Right.
And I think that's fine. As long as you were satisfied with the results, I don't think there's any reason to use more or less. I think that's probably the right dose for you. It's the right dose for just about everyone.
Okay.
Put your brows together for me and let them go, and then put them together as hard as you can. Okay, so you do have some line formation there, and it does tend to make you look a little bit angry. Lift up your brows and lower them, and lift up and lower them. And one more time. Most of your wrinkling in your forehead is in the very top of your forehead, which is the ideal person for treatment with Botox or Dysport in that area. Because your lines are up there, we can basically treat the top portion of your forehead without treating the lower portion, and thereby not dropping your brows very much at all. You should still have some retained motion above your brows as well, which is ideal. And nobody wants to be frozen. All right,
good.
so that's what we're going to try to do. Because we're doing your forehead and because eyebrow placement is always an issue, a difference in diffusion can cause one eyebrow to have a little bit of extra tone in it. So we see you back at a week, and we do any small touch-ups that need to be done. Only about 1 in 5 people end up needing a touch-up to their forehead, but certainly if you're the one of those 5, it matters a great deal to you. So if you don't need to keep your follow-up appointment, if everything's perfect, you can cancel it. But otherwise, come back and see me. We can do a very small free touch-up to get you exactly where you need to be.
Okay.
Sound good?
Sounds good.
Well, I know you've signed your consent form. Do you have any questions at all?
I think I'm fine. Let's do it.
All right. Well, I know you've had it before, so I didn't expect you to have questions, but I always want to lay it out there. You do remember that when the needle goes in, it's a very tiny needle, so you'll just feel a small pinch, but you may hear a kind of crunching sound.
I remember that.
That is the needle going through your collagen layer, and it's absolutely nothing to worry about. In fact, it's a good thing. If you have collagen, you crunch, and collagen is always good for our skin. So let me clean you up with some alcohol, and we'll get to your injections, and as you know, it's very quick. All right. Get my purple gloves ready and the alcohol, and we will get going on you, my dear. How's your life been treating you?
My life's been treating me just fine.
Well, I know you're a busy lady, so you must be going all the time. Pretty.
Thank you.
All right. We've got some alcohol pads here, and we're just going to clean up the areas that we're going to inject. I know you've taken off most of your foundation, and that helps, but really we just want the areas where the little sticks are going to be as clean as possible. There's almost no chance of getting an infection from such a superficial injection like Botox, but certainly we want the area to be clean. So are you nervous? Almost everyone is nervous.
Oh, I'm sorry. Okay, I'm nervous.
No, it's great. It's great if you aren't nervous. But I mean, you've had it.
I trust you.
You've had it before in your crow's feet, so you know how easy it is.
Yes, no
most first timers, are quite nervous, and that's normal. But everybody goes out thinking how easy it was, how silly they were to have been so nervous about something so small and easy. All right. Any preference as to which area we start with?
I don't. It doesn't matter at all. Do whatever you think's best.
All right. Sounds good. Well, right here I have a sufficient amount for your crow's feet, so I think we'll go ahead and do those with this injection. What I'd like you to do is turn your head slightly that way. Great. And smile for me. Good. You can see that muscle right there very easily in you when you smile. Go ahead and squint for me as well. Just squint like it's sunny. Very good. It's important that you spot the exact location of the muscle because it's very thin and you certainly don't want to miss it or you'll be wasting your treatment. This is Dysport we're using on Shauna. So squint one more time for me with a smile. There you go. And let go and relax the area as much as possible. Here's your first injection. Okay? Okay. Most people do not bruise with Botox or Dysport. But if they're going to, the area that will be most likely to bruise would be this area around the eyes, because there are a lot of small vessels coming out from the eye area. You have a tiny little bleeding out of one of those spots, and so I'm just going to clean it off. Put a little bit of pressure on there so that you won't potentially get a bruise. And we'll move to the other side. Okay. So far, so good?
So far, so good.
Good. You come around here. Excuse me, my dear. Great. Same thing over here. Just go ahead and smile. Great. I can see the muscle nicely. Here goes your first injection. Second. Third. And last. There you go. All right, one area done. Move on to your crow's feet, your glabella area and your forehead, and you will be done, miss. I need another alcohol pad, sorry. All right, I'm just a stickler for clean, Shauna.
Well, that's good.
I like to re-clean
We like
areas.
clean.
Right. Clean is good.
Clean is good.
Especially when you're inserting foreign bodies into you. Right? All right, now put your brows together. Good. And let go. And now put them together again and let go. All right, here comes your first injection, going into the corrugator muscles that pull the brow together medially. These are the ones that cause the majority of the vertical lines that people get in this area. But there are also small depressor muscles that create the semicircular portion to those vertical lines at the lower half, and we treat those as well. So surprisingly, a lot of injections for the central area there between the brow, because there are multiple muscle groups that we're treating. Did I make your eyes water?
You made my eyes water.
I'm so sorry.
That's okay, that's okay.
You're just a delicate flower.
That's me.
All right, so onto the forehead.
Okay.
We'll let you ooze a little bit there. There's no problem with doing that. So we have you raise up and lower, and here's your first injection. Raise up and lower. Here I'm targeting the area at the side of the brow. If we don't go far enough laterally here, we'll regret it because you'll end up looking like a bat woman. Lift up and lower. And lift up and lower. There you go, my dear. You are all finished. So how was it? Excruciating?
No.
All right, yeah, it's really not a big deal. Some people tend to ooze like this a little bit. Those people tend to be people that bruise easily. But usually within about 2 minutes, these areas stop oozing a little bit. And you can see where the volume was injected. After about 15 or 20 minutes, any evidence of that volume will be gone, and no one will be able to tell you've had anything done today.
Plush Medical Spa on Westgate in Dothan is excited to announce that we offer Thermage CPT skin tightening treatments for the face, neck, eyes, and body. Unlike older Thermage, the new Thermage CPT system allows patients to painlessly tighten loose skin in a single treatment session with no downtime. Tighten your neck and jowls or that tummy that was stretched by pregnancy with an immediate tightening effect that improves over the next 3 to 6 months. Call Plush Medical Spa today for your free consultation at 702-6869 or visit us online at plushmedspa.com.
Hey, Shauna.
Hey, Dr. Bell.
How are you doing,
I'm
honey?
How are you?
I'm fine. So it's been a week, and we did all 3 areas on you. So let's see what we've got here. Raise up your brows. Okay, you've got a little bit of motion left here on the sides, so you can kind of lift your brows laterally. Put them back down and lift them up. If you like, we can touch that up a little bit to get them back down, Or I actually think it looks kind of nice this way with you having a little bit of motion over there. You're not wrinkling the skin. Put them down and lift them up. Yeah, it's just slight. I think that's almost nice to leave that. It gives you more of a natural look where you can express a little bit. Now put these together for me. No, seriously.
As much as I do.
Well, that's perfect, obviously. You're not making any angry lines there anymore. Perfection. Turn a little bit this way and smile for me. That's great. Only lines you have on the side of your eye are coming from cheek motion right down here. There's certainly nothing coming out the side of your eye. Now squint and smile real big. Yeah, nothing at all coming out up there. It's all coming from cheek motion. So that's the best we could expect with all of this.
Good. I'm proud of it.
All right, very good.
Very pleased.
All right, well,
Thanks.
come back and see me anytime.
I will. Thank you so much.
Thank you, Dr. Bell, for educating us on all about Botox and Dysport. I mean, this has been great. And thanks to Shauna and Jim for being our guinea pigs and being
allowing
on the
us to
show.
stab needles into them.
Absolutely. And just please stay tuned to our next episode, because the next episode is going to be about the fillers. So make sure you tune into that, and we'll see you then. And thanks. Bye.
This has been Plush Tonight with Dr. Amanda Bell. Thanks for watching.
Plush Medical Spa on Westgate in Dothan has the perfect gift for your Valentine. Don't struggle to find the perfect gift. We have spa gift certificates in any dollar amount for any service or package. You can even buy them online at plushmedicalspa.com and we'll mail them for you, or you can pick them up at the spa. Get your sweetie a facial or a massage, or treat her to a manicure and spa pedicure in our beautiful private nail room where she can flip the channels on our big TV or surf the web on our free Wi-Fi. Call Plush at 702-6869 or visit us online at plushmedspa.com.